Hi, my name is Ann Schwenk, and this is case presentation study 2. I'm going to be talking about a new friend I have. I haven't known him for very long. He's 7 years old. He is in a general ed first grade classroom at a sort of Montessori type school. He's diagnosed with oppositional defiance disorder, although parents have some questions about whether that's accurate and if there is also an ASD comorbidity present. There's certainly ADHD comorbidity, but we're not sure about the ASD at this time. He communicates vocally. His excessive behaviors occur in a cluster. They're tantrum behaviors. So it looks like aggression, always against adults, never against peers, property destruction, crying with tears, flopping to the ground, vocalizing loudly, and eloping. His behaviors occur when he is presented with non-preferred tasks, such as hates his occupational therapy, hates handwriting, hates art, probably because all those things involve, the fine motor deficits that he struggles with. He also just dislikes all academic demands in general. So basically, if they're not in circle time or recess or PE, he's unhappy with the situation. Okay, so for operant extinction, he generally begins his tantrums with vocalizing and refusing, and that will escalate to property destruction, where he's throwing things, kicking objects, overturning furniture, then aggression, again, always against adults. I've seen this look like spitting, hitting, and kicking. Never punching with closed fists. It's generally slapping, kicking, spitting, and throwing objects at the individual. If he feels like his needs continue to not be met, he has had instances of eloping out of the classroom, running down the hallway, and a few times actually was able to leave the school grounds, which was very concerning, of course. Client school was allowing escape for problem behaviors by removing client from the demand and the classroom to the sensory room, which is an amazing place. And I'm sure sensory rooms are fantastic for many, many, many children. But I think that in this particular case, it's an inappropriate replacement, because when he goes there, he has access to stuffies, fidgets, even tablets. He can play games in here. In addition, his para is there, sometimes his counselor as well, just one-on-one, rubbing his back, helping him to de-escalate. There's snacks in there. So what it comes down to is he's escaping from the task demand. He's accessing all of these reinforcing things, and he's accessing this one-on-one attention. So it's just this one-stop shop for, if I kick, I get all of these cool things. So currently, previously the para would say, we're going to go here to calm down. But it was observed that as soon as he would become calm and he's totally regulated, and they try to reintroduce the classroom and transition back there, he would re-escalate himself. Even if he did not appear upset, he would just simply pick something up, throw it at him, and say, see, I'm not calm. We should stay here. So that's a pretty big indicator of what is driving these behaviors, if you ask me. So the BCBA recommended to the school staff, stop removing him to the sensory room for behaviors. Instead, maybe just relocate him to a corner in the room away from the other students so that they're not in danger. If he does actually need to be removed from the classroom because of disruption to other children's ability to learn, then he should be removed to a less reinforcing environment, such as the counselor's office. There's nothing to play with or do in there. So he can have all the time he wants to calm down, but it's not going to be a super fun reinforcing time. The para in the counselor's office in this situation would continue with the task demand, and the pair will ignore client's behaviors during tantrum with periodic reminders what he needs to do to move on to funner things. So, first finish up this math, then we'll go out to recess. Okay, so the assessment that was completed, a lot of ABC data, interviews with caregivers and school staff, and natural environment observation. So there's just a ton of observation happening to figure out when is this happening, what's going on right before it, and what is going on right afterwards. What is he getting out of it? His excessive behaviors were determined to be escape, access to the sensory room, of course, and attention. When removed to the sensory room, client was able to escape aversive tasks, access tablets and other tangibles in the sensory room, and got one-on-one attention from his para and school counselor. The non-contingent attention from multiple adults is a factor, and the behaviors were determined to be socially mediated. So client was placed on a DRA schedule of reinforcement. On a VI3 schedule, the client receives 1 token for working on task demands, absent challenging behaviors. After the entire task is complete, client is able to access the sensory room for 5 minutes. So do this, then yes, you can go hang out in the sensory room for 5 minutes, as long as you do this and you don't have any of these behaviors while you do it. He can turn those 10 tokens in for a work pass. So he can cash that in. I really super duper don't want to do this writing assignment right now. I'm going to use my work pass. So that's super effective for him. And that also allows for the escape aspect, which he so desperately wants. Of course, the replacement for the one-on-one attention, it cannot be one-on-one attention. So what he does get is consistent social praise, and he can ask and say, I want to have a little chat, I'm having some feelings, and so he can access that attention in a more appropriate way. Just you don't get unfettered attention for spitting on your 65-year-old first grade teacher, so pretty appropriate in my opinion that he gets consistent social praise when he's doing what he's supposed to, and he does not get the attention when he's not. Okay, so for reinforcers, we've got generalized reinforcers, which are the tokens. Conditioned reinforcers would be like the work passes and the access to the sensory room. And unconditioned reinforcer, adult attention and praise. I think that might technically also be a conditioned reinforcer, but I went ahead and threw it in under unconditioned reinforcer because per parents, he's always loved adult attention from the time he was a baby. So I might be wrong on that one, how I categorized it, but that should be that for the reinforcers. Okay, so for stimulus control, when client is removed to sensory room, problem behaviors stop as long as his parent and counselor are providing the attention, physical and verbal reassurance, and access to any tangible he desires in the sensory room. When behaviors cease and the parent attempts to transition him back to the classroom, client re-escalates and aggresses at para until he is allowed to stay in the sensory room, demonstrating that this is what he's trying to get at. This is the purpose of all of this. He wants to be here. He wants to be here. When he's not allowed to escape to the sensory room and is instead relocated to the counselor's office or a corner of the classroom, the behaviors decreased in frequency, magnitude, and duration. Of course, this is not, this is no mention of the extinction burst. There was a significant extinction burst when this new plan was implemented, and my clinic, allowed for an RBT to work in the school for extra support with the expectation that this would occur for 2 weeks, I believe. And yet the extinction burst was intense, and it didn't last very long though. So point being, the new plan did successfully decrease behaviors. Now, when the paras stopped providing intensive attention for long periods of time for problem behaviors, they also decreased. And removal of task demands are no longer an option. So client has had consistent data reflecting a significant decrease in problem behaviors and an increase in ability to complete aversive tasks. I'll also note that he's got an increasing trend on pro-social behaviors, initiating appropriate peer interactions, parallel play, and all those things which previously were simply not present or deficient. And that's pretty common in ODD diagnoses. So thank you so much for listening. I hope you have an awesome rest of your day.